The UK R number went below 1 today, so inevitably talk has turned to loosening lockdown. One source of inspiration is Israel, which has now fully vaccinated more than a quarter of its population. This chart of hospital admissions by age in Israel shows that the vaccine might be having an effect. You can see hospital admissions are falling faster in the older vaccinated group than they are in the younger, non-vaccinated group. Working these things out is complex, but that might be the vaccine's protective effect. Trouble is, we haven't seen a similar effect in the UK yet. Here's hospital admissions by age in this country. You can see it's falling among all age groups, which is good, but it's falling at the same rate. No sign here of a vaccine effect, which is why the Health Secretary is being cautious.
It's clearly good news that the number of cases is coming down. The plan is working, but we're a long way off getting this sorted. There's still over 25,000 people in hospital with coronavirus right now. So everyone can have confidence that the plan is working. What we're collectively doing together is having a really positive impact, but there's still a long way to go.
There are big differences, of course, between Israel and the UK. They're exclusively using the Pfizer vaccine and they're giving the second dose after 3 weeks, and we're not, and that's really important. These are the Israeli criteria for opening gyms, shops, sporting and cultural events and so on. We've got R below 1, but we are a long way off having the equivalent of 3 million people with a second dose of the vaccine. At our current rate, it'd take till May. But when I speak to scientists advising the government, they are looking at another measure apart from vaccines, this. According to the Office for National Statistics, cases in the UK are still very high, and they're not coming down that fast. The scientists are worried because the more cases we have, the greater the risk is of new vaccine-resistant variants. They want us to try and lower the level of cases at least as low as this, when we came out of the first lockdown. Of course, the Prime Minister might decide differently, but based on the scientists' advice, it does unfortunately look like this lockdown might have some way to go.